is a patient experience strategist. It means I collaborate with patients, doctors, nurses, the pharmaceutical industry, and sometimes academia and health tech companies to uncover solutions that help patients live better lives with their disease. As a systems thinker, I try to match the needs of patients with the needs of doctors, pharma, and other stakeholders involved in their care. But patients are always, always at the center. Patient experts, those with lived experience and specific skills that are relevant for client projects, bring not just their own voice, but the voice of many patients to each project. They humanize the struggle patients face in interactions with healthcare systems, doctors, medication experience, their life goals and objectives. Their voices help us to articulate the solutions that are never one size fits all. They all need elements of personalization because every patient is on a unique journey, and that uniqueness is exactly where the most important insights hide. Sometimes we encounter clients who've done prior market research. They genuinely believe that they know the answers already, and they may be just looking for validation or some specific insight they've missed. I think it's a shame, really, because we should always start projects with curiosity and an open mind. Merakoi uses different approaches to engage with patient experts, to try to take them out of their own journey, so they can think with us as consultants, not just patients. There are always surprises in each project. Just as an example, we had a project some years ago in lung cancer, and our client partner was considering changing the treatment administration due to a competitor product coming on stream. They were convinced that they needed to do this to stay competitive. What we learned, though, was that patients were so happy with their medication that they didn't even mind taking a few more pills a day. Honestly, it was the last thing on their minds. The patients we worked with across different markets had no intention of changing their treatment. It was an eye-opener for the client team, and it changed the way they're thinking enough to stop their dosing administration plans. But it also opened their eyes to something that was unexpected, which was that patients were already titrating their medication based on side effects, and this was much more common than the client team initially thought. So now they've added dose reduction options to their treatment guidelines. One thing we need to stop doing is using patients to validate thinking after patient solutions have already been developed or created. Patients should never be used as a tick box exercise. They should be brought into projects early, in ideation sessions, before any solution for them has been developed. What I'd like to double down on is the bridge between insight and action, making sure that patient intelligence doesn't just live in a report, but gets built into real decisions. That's where I see the biggest opportunity for our field to mature. If my work had a theme song, it would be Tamlin and the Fairy Queen by German folk band Fawn, because this song is full of whimsy but also sadness, and this is what I find working with patients. Hearing their stories can be heartbreaking, but we try to bring whimsy and joy to each project, both as a team and individually, to ensure that patients feel heard, valued, and that they know that we're on their side.
Tap that button. Subscribe now. Don't miss out.